Hi, everyone. We're just going to wait a minute or so to get started. Okay, should we get started, Judith?
I would go ahead, Sarah. Thanks.
Okay, awesome. Hi, everybody. My name is Sarah. I am the field development staff for Minnesota. Thank you guys for coming. Sorry. Before we get started, we just wanted to kind of go through the mission of Autism Speaks for some of the people that might not be super aware. So in order to enhance lives today and accelerate a spectrum of solutions for tomorrow, we use this mission statement as our guide. As you just read through it, I just want to point out a couple keywords and phrases that we'll see. For example, across the spectrum and throughout the lifespan, we know that there are various types of autisms, and that means varying levels of support are needed. And as we're all aware, our children grow up to be adults. So we want to be sure that we are offering those supports regardless of the level that may be needed from childhood through adulthood. You'll also, to go, as we look deeper, these are our 5 mission objectives. So we have increasing global understanding and acceptance of people with autism. We're really proud that we have made autism much more globally aware, but the next step is the deeper understanding and accepting people with autism. We also are at a catalyst for life-enhancing research breakthroughs, increasing early childhood screening and timely interventions, improving the transition to adulthood, like I just spoke about, and ensuring access to reliable information and services throughout the lifespan. We also just wanted to let you guys know quickly about our Autism Speaks Minnesota walk. To keep everybody safe this year, it is a completely virtual walk, so you can participate from wherever you guys are. It will be on October 10th, and you can always email or call me for more information, but if you go to autismspeakswalk.org, you can see more information there.
All right.
So now I'm going to turn it over to Judith, who is our Director of State Government Affairs.
Awesome. Thank you, Sarah.
Yep.
I hope everybody can take part in the walk. October will be here before you know it, so please check out the website, get in touch with Sarah, and thank you all for taking time to join us today. And just a quick disclaimer about the information we're going to share with you today. We're here to provide good info to you, but definitely if you need specific legal advice, seek out an attorney or someone like that. All right. So this is such a weird time, isn't it? And wow, thank you so much for taking time to join in to probably yet another Zoom meeting. If you're trying to access virtual learning, or if you're trying to work from home, you're probably doing lots of online activity. And this may be the last thing you want to do, but it's a great way to connect. So thank you guys for taking time to join us today. We hear you, and we know that this time is so challenging. We're hearing about lots of challenges that our community is facing in Minnesota and beyond. There's been this abrupt discontinuation of school services and day programs, clinics where you might access speech therapy or ABA therapy have been closed or shifted to telehealth. And although that's been interesting and beneficial in many ways, it also can be really challenging. Just being isolated and living in this stressful time can really increase the need for mental health services, and isolation is such a hard thing to deal with. So just that need for mental health supports is there now more than ever. There's a lack of connection to the community that is around us. And I know, for many families with autism, I talked about that isolation. We're familiar with that in many ways. And so the connections that we do have, whether it's a Sunday school class at church or a friend down the street, for my son, Jack, who's 16 and who has autism and a severe intellectual disability, one of his favorite connections is going to Outback Steakhouse every Saturday night. And so usually around 3:00, he will let me know. I have an example. He uses an iPad for his augmentative communication, and he lets me know he's ready for wings. And so when he's asking for his wings, I know it's time to go to Outback. And, from March to April to May to June to July, there was no Outback to go to. And for Jack, that was traumatizing. That was disappointing, devastating. It increased his challenging behaviors. It was just really hard for him. And for some, that might seem like a trivial example. For him, it's so disappointing. I will say we actually did get to go back in person a couple of weeks ago, and there was lots of social distancing and mask wearing, and all the protections were in place. But the staff, they were overjoyed to see him, and the joy on Jack's face, I think it was probably the happiest day of his life to date. And I hope there will be more, but just those little things really mean a lot. Employment that many people who are autistic have fought so hard to gain, and they deserve to be there, that's been disrupted. Respite, which can help families just stay afloat who are hanging on by a thread, that's been disrupted. Routines are disrupted. And then, of course, just basic income, trying to pay the rent, trying to pay utilities, trying to pay for therapy, and loss of jobs, business closures. It's devastating. I talked about challenging behaviors before. All of these factors, the change in routines, the isolation, no school, no respite, that's a recipe for disaster. And that disaster for many in the autism community can come in the form of challenging behaviors. And challenging behaviors affect people across the spectrum. They affect people who might self-injure, which is just devastating to see, or they might, experience aggressive behaviors that they take out on their families or their caregivers or teachers. It's just really hard. And Autism Speaks does have resources to help with challenging behaviors, but right now people are isolated and it's so hard. Access to healthcare has been really challenging during this time. There's a fear, for example, that someone on the autism spectrum could be hospitalized and not be able to have caregivers or staff with them to help communicate their needs. And then, of course, there's so much in the news these days about hybrid versus in-person versus virtual learning. And then no one seems to talk about what does that mean for students on the autism spectrum, for those who are consumers of special education. So that's just a long list of the many challenges that we're hearing about from you. If you have others, I would encourage you, please put them in the chat box today. We don't have your audio on or your cameras on because we're trying to save bandwidth so we can share this information with you today, but do feel free to share in the chat box if you have other things to add to this list of challenges that you might be facing. We also will be stopping periodically during this presentation to answer questions and just to give a little time for back and forth. But this is a hard time. We want to provide information to you and also let you know what's going on the federal and state level that hopefully will help. One more reminder, and we'll talk about this now and probably a little bit again later. I'm wondering if you've heard of our Autism Response Team. They're an amazing group of human beings who are manning the phones, manning the email inboxes, and even the chat boxes if you go to autismspeaks.org. They're Spanish speaking and there to help with all kinds of resources. So if you have questions that we don't get answered today in the chat box, for example, if we can't answer those, please reach out to our Autism Response Team, help@autismspeaks.org. They are there to help you. And so please take advantage of that. Okay, deep breath. We've talked about a lot of tough issues so far. And so I believe in acknowledging issues like that. And then I really believe in advocating towards solutions. I'm in search of a magic wand. I have not found one yet, but I have found that advocacy can really, really make a difference. So today, Sarah from our local chapter in Minnesota welcomed you, shared information about the walk, October 10th, please join. And now we're gonna switch over and talk about advocacy. We're gonna talk about advocacy occurring in Washington, D.C. on the federal level with your congressmen, your senators, the executive administration, all those folks. And then I'm going to talk a little bit about what's going on on the ground in Minnesota on the state level, share some information with you there. And then we're going to share a little bit of information too about resources that Autism Speaks has for you in your community right now. So I've done enough talking. Thank you all for listening. I'm going to turn this over to Dave Sikowski, who runs our Federal Autism Speaks advocacy team, and he's going to share with you what has been going on in Washington, D.C. these last few months and what may happen moving forward. So Dave, over to you.
Thanks, Judith. It's great to be with you all this afternoon. Appreciate the opportunity to talk with you all. As Judith mentioned, my name is Dave Sikowski, and I'm based out of our Washington, D.C. Office, well, usually when we're in the office, and I cover, as she mentioned, the federal policy issues for Autism Speaks. So what I wanted to do today is just talk with you all about what has happened broadly in Washington since the onset of COVID-19 in the United States. Walk through where we are right now, what we may see in terms of additional congressional action, and what we've been doing in terms of our advocacy with federal policymakers. And a lot of what we've been doing since the outset of this pandemic is trying to hear from the community and trying to take those concerns and help translate that into policy solutions that will be helpful. So definitely look forward to any questions that you have, and if there are other ideas or issues that you think we should be taking a look at, please don't hesitate to reach out and let us know. So back in early March, Congress began working on legislative bills, or started working on bills to address the COVID crisis. So back on March 6th, the first bill passed, the COVID one. We refer to all of these in order, essentially chronologically, as COVID 1, 2, 3, 3.5. I'll explain that. And just in terms of when the bills passed, and you'll see that sometimes referred to in articles, et cetera, about what's happening in Washington. So the first bill passed on March 6th, and that was really the initial amount of money that was put out to address the public health crisis and to provide additional public health funding. But really, the Congress began in earnest to address a lot of the challenges that individuals and families and small businesses, et cetera, were experiencing with the next several bills. So on March 18th, Congress passed the Families First Coronavirus Response Act. It included a whole host of provisions that affect our community. The one of particular note is it provided emergency paid sick and family leave for individuals at employers that have less than 500 employees. And importantly, it allows for individuals whose, if you have a kid whose school is closed or daycare center is closed, you're eligible for that, as well as if you're experiencing any COVID-related challenges. Also, importantly, one area of this that the Department of Labor clarified is that even though the law wasn't as explicit as we would have liked it to be, it does allow for parents of adults with disabilities whose regular source of care is no longer available because of the pandemic to be eligible for that as well. So that law also contained some important increases in funding for Medicaid, some tax credit related provisions, some testing related funding. But on March 27th, Congress passed really the large stimulus or large, I guess I should refer to it as a relief package that I'm sure all of you have heard about, that contained $2 trillion in funding for a whole host of different purposes. So the $1,200 per individual, $500 per dependent under age 17 stimulus checks or economic impact payments were included in this bill. The increased unemployment benefits of $600 additional per week were included in this law. Assistance for small businesses and other employers. This was the basically forgivable loan program called the Paycheck Protection Program. Billions of dollars for schools, which we'll talk about later on in terms of our advocacy at the state level related to that. Billions of dollars for the public health response, for state and local governments to address COVID-19, and an extension of the money follows the person program. So a lot of really important provisions that were contained in that law. But really, since that date that law that bill became law, there's been a significant amount of discussion about what we should do next and if additional action is needed. One thing that happened on April 24th that I would just point out here is this COVID 3.5 bill, the Paycheck Protection Program and Healthcare Enhancement Act. The reason it's referred to as COVID 3.5 is that while there hasn't been an agreement yet on the next large relief bill, this provided it was an interim step to replenish the Paycheck Protection Program, which ran out of money very quickly, as well as to provide some additional funding for hospitals and for testing. If we can go to the next slide, please. So where do we stand? Really, it's I put ongoing negotiations. Unfortunately, it seems at this point that negotiations are at a complete standstill. But I think what we could accurately say is there's competing bills at this point in both the House and the Senate, and there just needs to be a negotiated agreement before the next relief bill can become law. So back on May 15th, the House of Representatives passed the HEROES Act, which included $3 trillion in relief funding. The Senate pretty much immediately said that they weren't going to be taking up this bill. I mean, it covers a whole host of things, from providing additional stimulus checks to issues affecting the Postal Service, which I know have been in the news quite a bit recently, to housing-related provisions, more money for state and local governments, about $1 trillion. So a lot in there. We noted a few priorities that we had been engaged on that I'll talk about a little more in a few minutes, but this bill contained a substantial increase in funding for home and community-based services, included $100 billion for education. Dependents over 17 would be retroactively eligible for economic impact payments and eligible going forward for additional payments. Again, these are all things that were priorities that we've been talking to members of Congress about, but this House bill has stalled at this point. On July 27th, the Senate released its own $1 trillion relief package proposal, and there were several priorities like $100 billion in education funding, ensuring that all dependents would be eligible for a new round of stimulus payments. The Senate proposed $500. So after that bill was released, there's been a lot of negotiation or discussions, I should say, that have been occurring between the White House, the Senate, and the House. At this point, there hasn't been an agreement. Both chambers are on recess until September 8th. And so it's hard to know at this point exactly where things will go. It's a matter of these leaders coming together and reaching an agreement, and that will determine the scope and scale of what may be included. I should also note that the president did issue some executive actions related to unemployment insurance, related to the payroll tax, housing related issues. And I know that for most of those, the details are still kind of rolling out as to how they will exactly work in terms of how the federal agencies will implement them. If we can go to the next slide, please. Great, thank you. So so even though right now we're still at a bit of a stagnant point in the process, we continue to advocate with members of Congress and have been throughout the past several months to ensure that the needs of the autism community are being taken into account during those discussions. So we've been pressing for additional funding for home and community-based services, to ensure the availability of services for more people, to ensure that there's personal protective equipment that's being provided, to ensure that there's a continuity in the workforce, so that they're providing hazard pay and other types of incentives as well, to ensure that there's a continuity in that really important workforce. We have been advocating for additional funding to meet the educational needs of students with autism. Of course, right now it's, as Judith alluded to, there's a variety of different circumstances that each school district is experiencing in terms of whether or not they're in person or virtual. What we've just been advocating for is ensuring that there's dedicated funding, whether it's for virtual learning to ensure that the equipment is available, or for in-person learning for when students return, which in some cases is now, that the school districts have the funding to be able to make up for the learning loss that we know has occurred with many of our students over the past year or several months. So in addition to that, we've been advocating to ensure that the rights of students under IDEA, the Individuals with Disabilities Education Act, and other laws are protected. There was some concern back in March that there might be a rolling back of some of these core protections that have been so hard fought. And we, along with many others, push back against that. And unfortunately, at this point, there hasn't been any waiver of any of those core protections. We've been advocating to ensure that during this time, if you're not able to physically be able to see your physician or to be able to access therapy services in person, that there is access to telehealth. And we understand, the telehealth isn't going to work for everyone in every circumstance, but for some it does, and for some circumstances it is working. And so what we have just been advocating for is continued expanded access to telehealth, both during this pandemic and beyond, for those services that work. This should not be done at the expense, though, of eliminating any type of in-person services, really just ensuring that the things that are working are able to continue. So eligibility for the $500 economic impact payment for dependents over age 17. So in the CARES bill, the March 27th COVID-3 law that passed, while dependents under age 17 were eligible for $500 economic impact payments, dependents over that age were not. We saw that as inequitable. We heard from a lot of members of the autism community about this, and we've been advocating since to try to ensure in the next bill, whatever it looks like, that those dependents are made eligible. We've actually been working closely with some of the members from Minnesota who have been really leading this effort. Congresswoman Angie Craig and Senator Tina Smith have been the leaders in both the House and the Senate on trying to address this issue, and we've sent them letters of support for their bills, and so we'll continue advocating on this. Again, as mentioned, with the caveat that we're not sure where things are going yet at this point. I spoke earlier about according caregivers of adults with disabilities the same emergency paid sick and family medical leave policies according to caregivers of children. And then, and last but certainly not least, preventing discrimination in treatment decisions and care allocation based on disability. Especially at the outset of the pandemic, there was a lot of concern with limited resources that health professionals were making decisions about who gets care and who doesn't based on whether or not they had a disability. We of course thought that was wrong, and applauded the Department of Health and Human Services Office of Civil Rights, which sent out guidance to healthcare professionals across the country saying that this should not happen. We've also been advocating to ensure that group home settings have adequate amount of personal protective equipment for their staff and for individuals in those settings, because we've heard there were some horror stories about the lack of PPE that was being provided there. And so we've been advocating there, as well as to Judith's point from earlier on this issue of hospitals not allowing caregivers for individuals with disabilities to be present during a hospital stay, whether it was COVID related or not. So we put out statements around all of those issues, and so wanted to mention those here. So we've been working with members of Congress, as I mentioned, both Congresswoman Angie Craig, Senator Smith. We work with Senator Klobuchar actually quite a bit related to overall funding related to autism research. Congressman Chris Smith and Mike Doyle, who are the co-chairs of the Congressional Autism Caucus, have sent letters to congressional leadership advocating for many of the priorities we've articulated here. They had 40 signatures on the last letter that they sent, including Congresswoman Craig had signed on to that. And so we continue to press forward, even with the uncertainty that surrounds the entire process right now. We continue to try to push forward and bring these concerns to the attention of members of Congress. So I'll stop there and see if there's any questions, and thanks again.
No questions so far, Dave. Thank you.
All right.
Okay, great, thanks.
Yeah, and just to let everyone know, Kelly Hedrick, who runs our state government affairs team nationally, she also runs our grassroots, is managing the questions. So if you do have any, I know we're giving you a ton of information here, but please don't hesitate to ask. We want to make sure that what we're sharing with you is meaningful and makes sense. So please share your questions. All right. So with that, I don't know if you need to get up and stretch for a minute. Sorry, Dave. You're exciting. You're mesmerizing. We're going to move right into what is going on the state level too. So, you know, it's interesting. A lot of times I feel like what goes on in Washington, D.C. doesn't affect my day-to-day life. I don't know if you feel that way too, but it does. You know, we've definitely experienced that in the last few weeks with, you know, the paycheck protection program, with paid family leave, all the things that really affect us. And of course, those protections around the special education services that we frequently complain about, but now we're just like, we can't even get the basics. So what's going on in DC means so much, but definitely what's going on the state level is important. So I'm going to touch on some things right now. And I really just want to share with you some things you may know, some things you may not. So here we go. We're going to talk about your health care for individuals on the autism spectrum. Dave mentioned home and community-based services. Some people call those waiver services. Some people call them HCBS services. We're going to talk about those. And then we're going to also touch on what's going on with special education and early intervention during the time of the pandemic and moving forward. Okay, so we've shifted quickly into this world of telehealth, right? I don't know how many of you are actually accessing telehealth, but the numbers of people that I've heard who now are utilizing it are staggering. So, and it's overall been a good thing, although we definitely acknowledge that there are people on the autism spectrum who really struggle with telehealth and just doesn't work. But it's important that you know that when the pandemic began, CMS, which is the agency in Washington, D.C., the federal agency that oversees all the Medicare and Medicaid programming around the country, and they work with the states, they came out and really promoted telehealth through Medicare, through Medicaid, just so that delivery of services could be flexible. And definitely in Minnesota, that's been the case. And by the way, we're going to send a copy of this webinar to you via PowerPoint. And so there are links here that you can click through to when you get the file if you really want to nerd out and read all the policy information. So here we've provided information from MHCP where they're talking about what their telemedicine visits look like for those programs through Medicaid, through the Department of Human Services in Minnesota. So when I talk about telehealth services, I want to be clear. I'm not just talking about, you know, some sort of counseling session or, you know, a well visit with your doctor. I'm talking about the types of services that we actually fought many years for, you know, that are covered under Minnesota's autism insurance law and through Medicaid too. So things like behavioral health, including applied behavior analysis, speech, OT, PT, psychological, psychiatric care. Again, I want to acknowledge that might look a little different. You might not get as many hours, but at least you can continue to access these services in some way via telehealth. In addition to what's going on in Medicaid, the governor of Minnesota has taken some action, but for the most part, when it comes to private health insurance, that is state regulated or self-insured, the health plans themselves have really in Minnesota kind of taken the lead. So Blue Cross Blue Shield, Health Partners, Medica, they've all come out and said that they're going to cover telehealth services for the time being. Seems to be working for them. I don't know how your experience has been through telehealth or if any of you have had any sort of disruptions. I'd be interested to hear, but there are links to their policies here. So if you need additional information about that, it's available when we send this to you. Okay, in addition to telehealth, which covers, you know, kind of the basic medical sort of things like speech therapy and psychiatric services, behavioral services. There are also the home and community-based services, and those are services that are also called waiver services. And so those are a little bit out of kind of the medical model, and they might include things like day programming, employment programs, things like that. Those are overseen by Medicaid too. So there are a couple of things within Medicaid that CMS came out at the beginning of this emergency and said that they needed to have flexibility around, that we needed to have flexibility around. One is Section 1135. It's a waiver that provides flexibility for the state plan, for the state Medicaid plan. And then another is Appendix K, which I'll talk about in a minute. So, and forgive me for using all these section numbers and all this jargon, but Minnesota did take advantage of this opportunity to get waivers through Section 1135, and they were approved by CMS very early on in March, and then they reapplied for some other things in May. And so what does that mean? What do those flexibilities mean? It means, for example, I'm not going to read all of this, but I do want you to be aware of these flexibilities. Providers can provide services in different settings, so it doesn't have to be in a clinic. You know, it can be flexible. There's a modified provider enrollment process. The fee-for-service prior authorization requirements are temporarily suspended. So things like that. There are flexibilities around during this time of public emergency, and that's what that 1135 waiver does. If you're using Medicaid for your health care, or some of it overlaps with those home and community-based services too. I talked about Appendix K, which I honestly had never heard of before the pandemic. It's kind of a rare tool that CMS, that federal agency, uses when there's a big public health emergency. And usually it's just like in a state, you know, if there's flooding or fires or something like that. But you know, this is a national disaster that we're experiencing, a public health emergency, I should say. And so Appendix K was made available to the states, and pretty much every state except one, I think, has applied for Appendix K flexibilities for those home and community-based services. And so when you think about in Minnesota, what waivers that this would affect, it's the disability waivers, the developmental disability waiver, community access for disability inclusion waiver. They're all listed at the top of this slide. So all these waivers have been given flexibility about the way that services are provided. And there, I put links in here to all of the applications. Minnesota had a lot. They applied for several, but on the next slide, have a bit of a summary for you if you don't want to go in and read all of the jargon that's included on those individual applications. So what does this do for the DD waiver in Minnesota? It can expand settings where services can be provided. Payment rates can be increased for people who are providing those services. It permits virtual evaluations, assessment, person-centered planning meetings in lieu of face-to-face, and electronic method of service delivery. So it just, again, the whole goal is continuity of care during such a weird, difficult time. And there's a lot of information on the Disability Services Division website, and I put a link to that here. So they have probably 100 different questions that you can scroll down and look if you have a specific question about your waiver service. So just know if you're not getting your waiver services like you usually do, you should. There's flexibility around that. You might have to advocate a bit, but the Appendix Ks have been approved. The flexibilities are there during this time of public emergency. And these Appendix Ks were approved through the end of the year. So there's a little time left on those. Okay. The last thing I'm going to talk about, I've talked a lot, I'm so sorry, but thank you for listening, is something that's really weighing so heavily on the hearts and minds of teachers, families, individuals on the autism spectrum, people in the community, administrators. It's just a difficult time right now trying to figure out what is going on with special education services and also early intervention services too. So Dave earlier was talking about the CARES Act and the COVID-3, the CARES Act, which passed Congress several months ago, did include money for special education or for education, more generally speaking. And so some of that money was allocated specifically to the state of Minnesota. So if you want to, be a fun fact person at your next Zoom meeting, you can tell everyone that you know how much money Minnesota got for education from the CARES Act. And so they got $142 million for K through 12 services, and that's allocated to the schools with a calculation, that's preset. It does contemplate, students that have needs, students with special education needs, but it's a more general K through 12 kind of allocation. Post-secondary education received $227 million in Minnesota, and then the governor actually received $42 million to disperse using discretion. And so Autism Speaks has been advocating for that kind of funding. We're calling it GEAR funding, the governor's discretionary fund. And so we set some priorities based on all those challenges that we had heard about from the community that I talked a little bit about earlier. So we've had lots of concern expressed around access just to equipment to be able to access virtual education. Do you have a computer? Do you have a tablet? Do you live in a home where you have access to broadband or Wi-Fi? So just having that access is so important for basic special education if a student's able to participate in that way. Shifting a little bit, we've been worrying about transition and kind of on two levels. One is when you're a child that's in early intervention and you're transitioning out of early intervention and you're going into the special education system, there are assessments and meetings that take place. What's happening with those in Minnesota? What's the policy there? So we want to make sure that these little ones are actually moving into special education very carefully, and they're getting the services that they are entitled to under IDEA. On the other end, when you think about students who are aging out of special education, they're older, they're exiting out, they're moving into adulthood, they're supposed to receive transition services that help them go to the next step, whether it's a day program or it's post-secondary education or something else, depending on the needs of the individual. Those services need to be provided. They shouldn't be foregone just because of this disruption. And so we're trying to make sure with our advocacy and with this funding from the governor that it's contemplated in that way. And then just generally speaking, not considering transition at all into or out of special education, but just while you're in the middle of consuming special education. I know many of you are owed services that were missed because schools were closed or virtual education did not work. Those services are known as compensatory services. Some people are calling them recovery services, but we're asking that those be provided now, like as soon as possible. We know it's a challenging time, and we want families to have the appropriate options. Some families tell us they do not feel safe trying to access in-person learning, and it's important that they be accommodated, they receive special education in the individualized way that they should. For those who need access to in-person, we're advocating that that happen just as quickly as safe and as feasible because we know how important that is to families. So with that GEAR funding, there is actually information on the Minnesota Special Education website that talks about how this money has been allocated from the governor. It lists out the districts where the money went. So there is a link here that you can go to if you want to read those details about where that money has gone and be aware. And I would say too, I want to acknowledge that right now there's a lot of information coming down from Washington, D.C., and a lot of information coming down from the governor and from your state legislature. And then there's information being sent to you from your local school district. And it may be the statements that you're hearing are blanket statements, like everyone's doing this, or you can only do A, B, or C. I want to remind you that you still have an IEP, and the I still counts. It's an individualized education plan, and you have every right now to pursue a free and appropriate public education for your child with autism. You can work with your team. I know positive advocacy really works, but I would just encourage you to keep in mind as you're dealing with this situation, although people may try to disregard you or make blanket statements, you still are entitled to FAPE. The IEP still matters, and you still have the right to work with your team to make sure that your student with autism receives those special education services now. So we're trying to advocate from the top, at the federal level, from the state level, and I encourage you to the best of your ability, and I know it's hard sometimes with the lives that we're all living, but advocate at your IEP meeting, participate in your school reopening conversations as much as you are able. Our community needs that representation. Okay, and then just finally from me, I will say, I really want to stay in touch with what's going on in Minnesota. I want to support you. We have an advocacy Facebook page and a Twitter feed, and we also are on Instagram. So do your social media thing if that's what you like, and please follow all of these profiles. If that is not your jam, you can go to autismspeaks.org/advocacy. And then if you scroll down to the bottom, there's a place where you can sign up for advocacy alerts. Our advocacy alerts are succinct. I promise we're not going to spam you, but we will keep you up to date when things are moving in DC, and we need to hear from you when we're talking with your legislators, and we need you to talk to your legislators, and we'll also stay in touch about things that are occurring on the state level. So please do sign up for those advocacy alerts and follow us on social media, and you can communicate with us there. It gives you an opportunity to share with us what your concerns are and what you need from us. So thank you all for listening. And I don't know if we have any questions, Kelly.
Judith, you and Dave must have been excessively clear. We do not have any questions.
Okay, someone's going to ask Colleen a question. I know it. So now we're going to move forward to Colleen, who does community outreach for Autism Speaks. She has such a heart for our community. So Colleen, I'm going to leave it with you, and then you can feel free just to close out the webinar if you'd like.
Sure. Thank you, Judith. Hi, everybody. Thank you so much for joining us. I know I will tell you that I've been working directly in this field for over 30 years, and wow, I've never seen anything like this in my life. I don't think we will ever see anything like this again in our lives. And just hearing stories of families and also caregivers who are impacted and individuals on the spectrum who are impacted by this, it's just completely unprecedented. You know, I've never heard of anything like it. And I'm just so proud to work with this team on really important advocacy issues around COVID. I've worked directly in therapeutic day schools. I've worked in early intervention. I've worked at adults with autism, and I know how hard this is. I don't personally have a son or a daughter or anybody in my life with autism, but I would think over the years that the thousands of people that I've worked with have always touched my heart, and their families as well, and people who work with them. We certainly know that this is so hard because of all of the things that people with autism really do count on every day. You know, routine is important, and structure is important, and calendars and access to different events that happen, and that sameness is so disrupted, and it's so hard for our families. And, you know, parents are also, you know, here we go again with going back to school, and so many schools either doing a hybrid model or parents having to educate their children and young adults from home. And they're also trying to keep their own their own normal work life, working from home in a lot of ways, and also being a teacher and taking on that role, and being a therapist and service provider. And we know that that's incredibly hard. We've also heard through our autism response team that adults with autism, many of whom have lost their jobs, or if they haven't lost their jobs, they've had to switch to working remotely. And we know that that's been particularly challenging as well. And then, but I will tell you that one of the things that we did in early March when this all really came to fruition was get together as a team with services and supports, which is the mission area I work under, and just say we have to start building out resources, and we also have to collaborate with other organizations with whom we have relationships to see what they're doing as well. And I've seen and heard quotes on social media that I do frequently repeat, and one famous quote is that we're all in the same boat, and that's really not true with this situation. Everybody's boat looks different, but we are all weathering the same storm, and everybody's in this together. So please know that we're here for you in any way we can be, to whatever capacity that we can be. Next slide, Judith. So if you go to, I'm sorry, I jumped ahead. This is a repeat slide, and it's in here on purpose. And we put this in here because so many people do not know about this wonderful team, and we want people to know about them. So please share this information out. I worked really closely with this team. They're part of services and supports as well. And it is truly just an amazing feat what they do every single day. They, as Judith said, between 9 and 5 local time, they are taking calls, live calls. They take live chats. We do know that a lot of people, especially individuals on the autism spectrum, don't like to have sometimes phone conversations, or they can be challenging for some people. So we offer just a direct email line that people can reach out to them. And the beautiful thing about this is that we are really wrapping supports around the entire community. This isn't just parents reaching out. It's friends of people with autism. It's people with autism themselves. It's caretakers. It's teachers. It's social workers. You know, family members of people with autism. It's really open to everyone. And you know, we've had so many people say, I just need to talk to somebody. I'm just having such a hard time with everything that's going on. I really just want to talk to someone. And every single one of these amazing staff members has either a personal and or professional connection to autism. Some are social workers, some have a special education background. I can't speak highly enough of them. So please take advantage and please tell people about them. Next slide, Judith. So this just shows a little bit of some of the different categories of information and resources that we have. And these are rapidly changing, and we're adding to these daily because, again, the situation is really fluid. But one of the things that we know is really popular right now with people either just returning to school or going back to school within the next few weeks is virtual learning and summer activities. There's a whole section on our website under our coronavirus resources that have links to this. These are amazing, and there's a myriad of them. So if you click on one particular link, it'll open up a bunch of different options. And these are really for, they're age appropriate, they're across the spectrum, really throughout the lifespan, which is very nice. There's also very specific articles about how to handle clinical care right now during social distancing and school program closures. What just in general should the autism community know about the coronavirus outbreak? There's just, you could spend hours on here looking at these resources, and they're just phenomenal. We also have local Facebook and Instagram pages. So if you go to the Autism Speaks Minnesota page, there's a group, and it's a closed group. Please join that because we very often post a lot of these resources and local information on those pages as well. Next slide. So this is just kind of what our front-facing web page looks like. If you go to autismspeaks.org, you will see this. And then right now at the top there is kind of a goldish color yellow banner where all of the resources are housed regarding COVID. However, you can see here also there's many other topics that are specific to autism and really wrap around what's going on as well. What we did about a year and a half or 2 years ago was structure our website so that all of these are searchable by topic. A couple of them, and noteworthy for what's happening right now in our communities, under school. for example, if you click on school, there's information about IEPs, and we have most recently turned a couple of these resources into digital resources. The IEP one is a digital resource that you can maneuver through. You can put level of support that's needed in, as well as our transition to adulthood resources as well. They've recently created roadmaps and transition to adulthood under housing and supports, under post-secondary education, and also under employment. So there's specific roadmaps to each of those under here. And a lot of people don't know about, again, the plethora of resources that we have on our website. So take advantage of these. They're fantastic. They're free. They're downloadable. If you can't find something that you're specifically looking for, that's a great opportunity to reach out to the Autism Response Team. They will send you the link really quickly. Next slide. I always do that, and I always think there's another slide, but it's the final slide. I don't think there's any questions, but I do want to just say, and this is really from my heart, I have worked closely with this advocacy team more so in the last 5 months than I ever have before, and I'm just so impressed with what they do and what they do on your behalf and your loved ones' behalf. You know, they are working federally to work on big picture legislation topics, but they're really drilling down to local topics as well, and that's so important. It's just, that's why we're here, and this is the work that we do. We're here to support you. We might not have every single answer to every single question, because as Judith said, there's not really a magic wand right now for anything, but we do, you have our support, and you know, we will do everything we can to help you through this time and beyond. So we know your time is really precious. We want to thank you guys so much for joining us today. Please share this out. You'll get a link to the recording, and if there's some person that you knew wanted to attend and couldn't, we will send you the link, and you can feel free to forward that. We'll also put this on our local Facebook page at the Autism Speaks Minnesota page, and then we will upload it to our YouTube channel. But please stay safe, everyone. Be well, and thank you so much for your time today.